الكارديوفاسكولار ايمجنج في عين شمس، بس انا شايف التيم كله في ميل يا دكتور وحيد. انتوا وديتوا الولاد فين؟
مفيش الا احمد سمير هيقضوا عليه بعد شويه وخلاص.
تقدم اللي في الاخر دكتور وحيد، تقدم الاثنين النواب.
في دلوقتي move on to interesting cases by residents. منة الصادق هتقدم لنا حاجه.
Good evening, everyone. I'm Minatallah Elsadek, and today I'll be presenting an interesting cardiac case that should not be overlooked. We have a 58-years-old female patient who presented with chest pain and dyspnea. We immediately suspected a cardiovascular cause, therefore coronary CT angiography was done. Now this is the pre-contrast phase, which is used to calculate the calcium score and measure the risk of coronary artery disease. We also use this phase to check for any extracardiac abnormalities or pericardial thickening, which is not present here. We should also check the lung window for any extravascular abnormalities, and here we can see non-specific atelectatic bands. Now this is the axial cut with contrast. In our case, the calcium score was 0, which indicates no risk of coronary artery disease. This is the curved MPR showing the LAD. This is the RCA, and this is the LCX. The three vessels are totally normal in our case. Now here we noticed a dilated right atrium and right ventricle with no septal defect noted. We also noticed that the SVC is receiving one of the pulmonary veins, yet the rest are draining in the left atrium, which is consistent with right-sided supracardiac partial anomalous pulmonary venous return. In such cases, we should also measure the pulmonary artery diameter, and if it's more than 3 centimeters, this may be pulmonary hypertension or overflow. Pulmonary hypertension in such cases is considered group 1 pulmonary hypertension. Now to sum up, we have a case of right-sided supracardiac partial anomalous pulmonary venous return with the subsequent dilated right atrium and right ventricle. The scanned epicardial coronary arteries are free from any significant lesions. So what is anomalous pulmonary venous return? It's a rare congenital cardiovascular condition in which the pulmonary veins drain into the systemic circulation rather than the left atrium. If some of the pulmonary veins, then this is partial, and if all, then this is total anomalous pulmonary venous return. We have three types of partial anomalous pulmonary venous return. Type 1, which is the supracardiac, in which the pulmonary vein drains in either the brachiocephalic, SVC, or azygous vein, and it's the most common type. Type 2, the cardiac, drainage is into the coronary sinus and or the right atrium. Type 3, the infracardiac, the pulmonary vein drainage is usually into the hepatic veins, portal vein, or IVC. So our learning points are that coronary CT angiography is not only for the coronaries. We have to scan the heart, mediastinum, extracardiac structures, and lung to assess any abnormalities that may be the cause of the chest pain. Whenever there is right-sided enlargement of the heart, we should exclude anomalous pulmonary venous return. Thank you.